All right, it's Tuesday. We want to welcome you to Coronavirus Inside the Arizona Numbers. I'm Katie Rammel. Alongside me here, Garrett Archer, as we do every single weekday afternoon, help you break down the numbers, help you find info you would like all over for Arizona. We concentrate on Arizona numbers, but Garrett, lately we've been hearing from folks all across the nation who are joining us on here. So we want to welcome those viewers as well and say that we hope that some of these showing you where to find these numbers in Arizona also helps you to find those numbers in your state. And before we get started, sort of a mixed bag today on our numbers, but before we get started, if any of you are interested in getting tested, there are absolutely short testing lines out there right now, shorter lines than we have seen in a very long time. So if you're looking to get tested, one of our reporters out there at one of the testing sites is telling us that there are more cars in the parking lot for the workers who are out there than there are for people getting tests. This is a total about face than what we saw last week at this time, Garrett. We were talking about long lines. We were having to warn people on here to gas up their cars, to take plenty of water in this Arizona heat and be ready to be out there for a number of hours. So a total 180 in this, and we'll have the full story for you tonight in our evening newscast. But in the meantime, we really want to talk about the hospital numbers, but let's get to the summary page first, Garrett, and how things are looking for today.
Absolutely. So I've shared the screen so that we can look at it. We have in Arizona 148,000 cases so far, and that is 3,500 new cases reported today. We did have a very rather high death number today, 134. That was with certificate surveillance being done again. And that brings our death total just under 3,000 to 2,918, meaning that it's very likely that we are going to be above 3,000 deaths by the end of the week. And then here we are with our diagnostic tests, 14,000 diagnostic tests reported today with a percent positive for the total cumulative of 14.6, which is a tenth of a point higher than it was yesterday.
Yeah, and one thing we noted, for those of you who weren't with us yesterday, a big number up in the top right corner of Garrett's screen right there, passing 1 million COVID-19 tests here in Arizona. Keep in mind, that's both the diagnostic tests, which would be the nasal swab tests, and the antibody tests. So those numbers are added together here in Arizona, over 1 million tests already. So, something worth noting there. Garrett, talk about that the certificates and what that actually means. We had a number taken off the charts yesterday and put back on today. Can you explain a little bit more for people who weren't with us yesterday what that in fact means?
Yeah, so certificate surveillance. So you have to think of this as sort of there's sort of two processes going on when they add deaths and sometimes cases and hospitalizations. One of them is an investigative process where there's teams of epidemiologists at the AZDHS that are getting information from county health departments, inputting it into a system, verifying information, and being as meticulous as possible to make sure that they have the correct data that they're putting out to the public. There's a second sort of process that also happens, which is a death certificate surveillance. So what that is that's when the health department queries hospital systems, medical examiners, other places where they're not actually getting, maybe data may have been missed to them, and they pick up a bunch of death certificates that were coded COVID-19 and possibly the summary page or something, and then basically that information gets put in batch on the COVID-19 death curve. And then what happens is then they have to go back and actually check to see if those dates are correct. So what happened on Saturday was, after a large certificate surveillance of 147 the day prior, they actually pulled about 50 deaths off of the curve the next day. And while they did not change the total number of deaths, they just pulled these numbers off of they pulled these off the curve. So what happened today was they simply verified these dates of occurrence and then put them back onto the curve. And we'll see that shortly on the epi curve that I provide that shows sort of the dark blue, light blue contrast on where things were added. And we can see that today a lot of deaths were added all across the entire pandemic that's been tracked.
All right, we'll get, producer Carrie saw this comment as well, or is cracking up at this comment from Josh. He writes, Garrett's like data Batman. We agree, Josh, although Garrett probably prefers the count, his Twitter account, because that's the photo that's on there. All right. Some people are asking about the testing sites. Go to Nicole Griggs' Twitter account and you'll find out exactly where she is. But really, our reporters are stretched out across the valley, and the lines are very short for testing everywhere. So just try to check whatever place with your doctor or online or on the Arizona Department of Health's website, and you'll notice that the lines are a lot lower today, or a lot shorter today. So hopefully that helps. So if you were discouraged, and there's Nicole's Twitter address, and in fact there's some photos on there, you can see how empty the parking lot is. So just an incredible 180 there. All right, the other thing we want to talk about very quickly is that we're getting closer on the clinical trials and on the vaccines. We're trucking away, trying to get there as fast as we can. And there are 2 different places that are doing research here in Arizona right now. If you're interested in being a part of this, we talked about this in our newscast at 10 o'clock last night, but let's see, let me give you the email, the web addresses rather, if you'd like to go check them out and sign up and be a part of this change. It's HRIAZ.com. That's one site. That's Hope Research Institute. And they're going to direct you. You'll see on their page, it's got Arizona. You can click on that and get more information about those trials. The other site is CCTresearch.com. Those are 2 places that are doing testing right here in Arizona. If you're able to be a part of it, they do compensate for you to do that. Now, Garrett, we want to get to some of the hospital numbers, because wow, if we're looking for good news and hopeful news, we're finally finding it in some of those hospital numbers. All of them were trending down today, except emergency room visits.
Yes, everything trended down today. So let's go through those really quickly. We're going to go to the dashboard, go to hospital bed and usage availability to check the entire census. And as you can see, we're finally seeing in the ICU census numbers, which this is COVID agnostic. This is just the entirety of ICU beds being taken up. And you can see we're starting to see a downward trend there. We're now at 85% of ICU beds occupied. Here is the emergency department. This one, as you can see, there's a lot of fluctuation here. We're at 43%. Inpatient, which is all acute care beds. Anything basically at a hospital that isn't an ICU or maternity bed is considered an inpatient bed. And here we're at 83%. So all of those down. We'll go to ventilators really quick and check that. And you can see that that has been level for about 3 days now at about 49%. And then going to the actual COVID-19 specific metrics, this is where we've seen a fairly strong decrease in inpatient COVID-19 metrics, 3,041. The last time we were at that level was July 2nd. So we've been going down pretty dramatically there. We've also had a drop in ventilators to 608 used by COVID patients. ICUs, 865, that's also a drop. Discharges, another drop there to 345. Emergency department visits, yet another drop. That one's down to some of its lowest numbers since, again, first week of July. And then intubations down to 73, back to where it was in early July. So essentially, we're seeing in hospitalization assets and resources, we're seeing basically a reversion to where we were prior to the 4th of July weekend and prior to sort of all these massive lines in testing. So the hospitals are seeing a little bit of a respite right now.
Yeah, and those measures that were put into place as well. We saw Maricopa County go ahead and add masks required for people being out. We also saw the bars shut down, all the clubs shut down. We saw the gyms shut down. So a lot of changes have come in those past few weeks. Now, will this all stay? How long it'll be in place remains to be seen. Of course, those extra closures were set into place until July 27th. We'll be waiting for the governor to speak on, we're assuming he'll talk about this on Wednesday. Usually midweek is when he gives the updates. All right, Michael's asking, how true is this data? This is the data, Michael, coming straight from the hospitals here in Arizona.
Yeah, this data is not even. This is a pass through, sort of like an API if you're into programming and whatnot. This is a pass through that the hospital systems are sending over to the Department of Health Services with no one else touching it. So this is just aggregated from the hospital systems. Something does need to be said though on this data, because I know that there are reports out there that some areas are like, well, we're seeing all these downward trends in hospitalizations, but we're still saying, this hospital, specific hospital, still at max capacity. Well, that obviously can still be the case. These are statewide numbers. So in places like West Phoenix, where there's still hotspots and out there, some of the hospitals out there can still be stressed, whereas some of the other areas in the state are no longer stressed.
Mary Ann is asking, are any of the discharges a result of deaths? So some of the numbers could be a result of deaths in there, Garrett, but our deaths don't outnumber the number or outpace the number that this is going down.
Yeah, so we are seeing, this is a very good point, Marianne. We are seeing a larger number of deaths, and a discharge is just simply the release of a bed. So that does mean that deaths can be incorporated into that discharge number. But as Katie said, there's, the discharges have been outpacing deaths for quite some time. So the chances are these discharges are the majority of these daily discharges are just people being discharged from the hospital.
Yeah, are true to that. I just want to get back to a comment just a second ago. Oh, Karen writes, I've had enough friends and or family die. Karen, first of all, our thoughts are with you, and that's why I want to take a moment with this comment. I'm so sorry for your loss, because there are so many families also going through what you're going through here. Almost 3,000 families in Arizona have lost someone. We've seen, obviously, the cases across the country grow to more than 140,000 deaths here. That is a lot of friends and family lost. You are absolutely right. So, Karen, I just wanted to take a minute and recognize your comment and say that we're thinking of you, and we're so sorry for your loss and everything that you've gone through. Garrett, there's so much focus all the time on, death versus survival. Death versus survival, that there is such a giant area in the center of people who are still fighting for their lives, who are saddled with giant medical bills. I mean, massive medical bills after all of this. There's people that have experienced job loss, or they can't get back to the job that they once did because they physically changed. And so although we talk about the numbers in death and the numbers in life, there's this whole wide span of survival that has to be accounted for as well. And it's not survival as you were before you were hit with this virus necessarily.
And this is exactly why the AZDHS has not settled on a recovery number. As you say, there's so many outcomes and so many sort of different pathways that this virus can take that, there are sort of ways to measure recovery, but I know people ask constantly on that recovery number. And the best we have and what is being used by Johns Hopkins University and all the other sort of tracking is the hospital discharges, because that's the best proxy we have for recovery, even though, as you stated, a lot of those people that are discharged from the hospital wouldn't necessarily be considered recovered.
Yeah, people's definition is going to be so different of what a recovery looks like. The best number for those discharges that we had, so for people who are asking about recovery, at this point in Arizona is about 18,000. So that's often why you don't hear that number on the news, because it needs an asterisk by it that explains all of it, that says why that is the way it is. So it takes a little bit more explanation, and until we have some sort of specific definition on what recovery is, that's the best that we have for that. We were watching our numbers compared to other places across the country, and for a while there were a couple metrics that Arizona sadly was taking the top spot in some of this. I know as far as case count goes, we have the third county in the nation, but counties are not exact in size. So we're more in line with how the county size is in respect to the number of cases. So it's not fair to compare, a small county in North Dakota to Maricopa County, because the size is so different. But we are maybe about where we should be as far as population goes in that route. LA County is number 1, Cook County is number 2, and then Maricopa County, we fall to number 3 for case count strictly.
Yeah, and that's using like you said, the raw number counts, sort of the linear counts of what's going on. And while that does sort of give you an idea of how COVID-19 is distributed across major populations, you do want to use the per capita numbers for looking to see what areas have been impacted harder, which counties have been impacted harder. I do have a chart for that that I can pull up. This is a county case chart for COVID-19. I'm see if I can bring this in a little bit closer. Is that a little better?
Yeah, it's great.
So I'm going to put this in at case per capita. And what you can see here, and I'll put it on the linear scale because it's a little easier to see that way. This is basically, as you just said, this is taking all of Arizona's counties and equalizing their populations. So, pardon me, here you can see that Santa Cruz County, very small county on the southern border south of Tucson, it is the highest per capita COVID rate in the state, followed by Yuma, which is another southern border county. You can see here Navajo and Apache. These are both Navajo Nation counties. I would not consider them as to having a bad COVID-19 rate any longer. As you can see, the doubling date for Apache County is 55 at this point. So they're no longer at the same levels they were. But you know, this is a way you can see, like Maricopa County, biggest county in the state by far. And it's right now the fifth most impacted outside of the two hotspots that have already cooled down. So, you know, it's a concern for the urban counties. So this is just something to watch.
And Garrett, where can folks find that chart? Is that an internal chart for us?
This is a chart. I show this on Twitter usually once every 2 or 3 days, but this is my chart, yes.
All right. We appreciate you putting that together because it helps us get a better idea of how things look. When we're talking about the dates of death, and the Arizona Department of Health site is matching those dates and sort of setting things up for us, and you're plugging it in, peak dates adjust. So when we have more certificates added to that date, obviously that's going to adjust out. Where are we right now? Where was the highest day that we've tracked? How high was it? And how long has it been since that sort of shifted?
So yeah, I'll see how quickly I can do this.
Oh, no worries. It's okay. While you're pulling that.
While I'm doing this, yeah.
While you're pulling that up, I'm seeing some questions about the schools. So I just want to let everybody know that the school information is changing so fast. We have an excellent reporter who is all over it, Daniel Lerner, and this address that's on the bottom of your screen right here, www.abc15.com/schools, has got everything you need to know. It's got the plans that are being considered. It's got the plans that are put into place. It has the start dates for schooling, and then it has the dates that in-person schooling will start. If a plan is still being talked about, you can find that on there as well. Daniel's Twitter account is @DanielLerner, and the website, though, is awesome because it's got a map on there, and you can just hover over the school district near you or your kid's school district, and you'll be able to find out, or your grandkids, find out all the latest information and their plans on there. So things are changing by the minute here in Arizona schools as we get ready to make plans for our kids, for our teachers, for our staff, for our educators. So we're expecting an update on that also from the governor this week, but that's where you can find that right now. Oh, Donna's saying in school only. A lot of the schools, Donna, have already moved back their dates, either past August 17th, which was the aspirational start date. They've moved some of them past Labor Day, and then others have moved past fall break as well, which we have here. So for those of you watching from other parts of the country, we have a fall break that happens in October, and a lot of those are after that date on October 13th. Katie's asking, what's the website? I think you're asking for the school's website. Message me on there if there's a different site you're looking for. But Katie, that's abc15.com/schools. So Michael's saying, teacher in AZ for over 20 years. We love that. Let me know what school you're teaching at. Love to hear that. Thank you. We need our educators. We need our teachers. And we absolutely need to keep them safe as well. All right. How are you doing, Garrett?
I'm good. I'm ready to go. So
all right.
So to sort of address your question sort of in two parts here. So the peak death date right now is July 7th at 73 deaths. And when you're looking at this chart here, just to understand, dark blue well, I'll just start with light blue. Light blue was all of the deaths that were added today, and dark blue was here yesterday and beyond. So as you can see, there was a lot of changes to the curve today. That's what we were talking about, those deaths being re-added into the curve. You can see all over the place, even coming all the way back to the very beginning of the pandemic, there was a death added. So a lot of changes. July 7th, but just because of the way that the nature of how this works, it's looking that we're going to shift to July 9th, probably in the next day or two, as being the peak death date. It was it has been July 7th since the 18th of July. And so it's, like I said, probably in the next 2 or 3 days, we're going to be moving to July 9th being the peak death date.
So Garrett, I remember we were talking on here, and it was like June 26th or June 29th at that point, and obviously we've been doing this for about a month now. Did it jump right from that date over to the 7th, or did you see it kind of migrate? I see another high date in between, but it looks like that as those dates have just been added in.
Yeah, it's been migrating, as you can see sort of right here. This was a peak death date at some point. This has been a peak death date. This has been a peak death date. So it has been migrating over time, especially during this this increase. Back in June, as you said, when we were first in the beginning, this right here, this date in May, this held the peak death date. I think this is May 8th. This was the peak death date for probably for 2 months. That was the peak death date. And then once we started this sort of infection rate climb, we started to see the date shift.
Yeah, Mary Kay's asking, so these deaths were incorrectly categorized originally? Go ahead.
I wouldn't call them incorrectly categorized. I would say that they're using certificate surveillance to find this data. And so what they're doing is they're going through what was caught, and they're basically correcting and re-verifying the dates. So I wouldn't call them incorrectly categorized. They were not incorrectly categorized. They were already considered COVID-19 deaths. They just brought them out and brought them back in with the correct dates.
Yeah, and Mary Kay, we should stress to tell you that the people who are working on these numbers at the state and at the county, they are extremely meticulous. They are highly degreed, very educated, and they are very dedicated to making sure all of this is right. So tons of confidence in what they're doing. Let's see. Oh, you know what? Just a second ago, Michael said he teaches at Phoenix Union. Michael, thank you. Big shout out to Phoenix Union. He says, thanks for the support and the love. No, we are happy to support our educators. I'm not born in Arizona, but went to high school at Saguaro, have a lot of Saguaro pride and pride in Arizona overall. So thank you, Michael. Debbie was asking, why over 1,400 today? I'm not sure what 1,400 number she's looking at, Garrett. We had 3,500 cases today.
Yeah, I'm not sure what the 1,400 is either.
First of all, Debbie, we're so happy to have you. We love when we see your name come up on the screen, always adding great stuff. So I want to touch on that. For Debbie and others, we're at 3,500 additional cases today. The deaths were at 134. So basically, we're almost pushing up for cases on the 150,000 mark. We'll probably hit that. Oh, I don't know. What do you think?
We'll hit that tomorrow, likely.
Tomorrow? Yeah.
Likely. And we'll likely hit both the 3,000 mark for deaths and cases at 150 tomorrow.
Yeah. Wendy's asking, how can people still think this is fake? Wendy, I have no idea. You know what my best guess in all of that is that it hasn't touched their lives directly yet. Because once you've lost someone to this or seen someone sick with this or fighting through this, I just don't think there's any way that Diane agrees with me. You unbelievers have a family member die like us, and you will believe. Diane, you are exactly right. So many people watching friends and family struggle through this. When we talk about the death count here in Arizona approaching 3,000 families affected, there are others who have watched their family member fight through this. We did a story last night of a paramedic here in Arizona who they called his family 6 times and said, get ready to say your goodbyes. He's not going to make it through this. And we did his story last night as he left the hospital. You can't believe what his family has been through in the meantime. And they knew that they called him their Superman. And they said that he would fight through this and he would keep fighting. And boy, he was able to. And he walked out of, he was wheeled out of the hospital. Then he went to a rehab center for a long time. And now he's been able to walk with his own 2 feet out of that rehab center. So many families affected by this, so many lives lost as well. Let's see, what are some of the other numbers you saw today? And then I'll get back to some of the questions.
I do want to go over the lag in testing. So that's something we
So
need
this
to
is what
touch
we
on.
talked about yesterday with folks, and wanted to better explain it. How far back we could trust the data at this point in some of these numbers coming in, because there's such a delay in the results from testing.
So we actually Quest Labs, which owns Sonora Quest, sort of confirmed some of our suspicions yesterday on the lag. We sort of calculated out the lag. I calculated out the lag to be anywhere from 1 to 13 days. That's how long you can expect to possibly get your test back in 1 to 4 days, or 7 to 14 days seem to be the two hills. So what sort of Quest Labs did yesterday was they confirmed that, saying that there was a prioritization of tests that were coming from the hospitals that were getting 72 hours, but then there was these other tests that were taking 7 to 14. And you can see that here. I'll see if I can bring this down. This is Sonora Quest's dashboard that they release every day, and you can see a pending PCR diagnostic test of 62,700. So we know that right now there's a backlog of at least 62,700, if not more, tests in Arizona, just based off of Sonora Quest being the largest of these, and then some other labs would also likely have some sort of lag as well.
How does it say, or do we know how many they're catching up each day? I mean, are they processing like 15,000, or do we have any idea at this point?
They do. Let's see. I believe in here they will. There is a date of processing. So that's 1 second. I'm sorry. There usually is, and I'm having.
And this is their website. So anybody can
go to the website. Yes.
Okay, so Sonora Quest Laboratories, for those of you who want to check that out. While you're peeking at that, we'll let you look it over for a few minutes. I want to remind people, I got some more questions about the research and the vaccines that they're working on. The sites, there are 2 different places right now at the least that are doing Arizona-based clinical trials in all of this. So the addresses, if you're able to be a part of that study, are HRIAZ.com, HRIAZ.com, and then CCT Research. CCTresearch.com is that site. Now, they do compensate for the testing, and I believe that the Hope Research Institute trials start on the 27th. Would that be Monday? We're about 6 days away. So if you'd like more information on that, or that's something that you can take part in and help be a part of the change and helping us get closer to a vaccine, that would be how to take part, how to help. Any luck, Garrett?
No, unfortunately, there is one other table, but I guess that's a media table, and I have to go through and see if I can find it, where they do have sort of a day-by-day of process tests, and it's not on this dashboard. So I'll try to report back on that tomorrow.
So we could be in this lag for maybe just a little bit.
Yeah, I mean, we processed 14,000 tests today, or that were from this lag, but at least 14,000 were added into the system. We're hoping that we need to start seeing numbers of 17, 20,000. We seem to have this sort of 15,000 capacity that we're sort of running into every single day. So we're hoping to see that ramp up as the governor made his Project Catapult. What he wants to do is to increase it to 35,000 a day. So we'll see if that happens.
Yeah, and as we mentioned at the beginning of all of this, some of those areas where you can go get a test today are empty. So if you were thinking about getting a test done, today would be a great day to go out there. Our reporter, Nicole Grigg, has been out there this afternoon saying that there are shorter testing lines. She has a photo on her Twitter page right now taking a picture of the parking lot, and it is just empty. Just a total stark contrast of what we've seen about a week ago. Stephanie joins us, popped in late with the amount of positive news today and the amount of deaths. Are we headed in a better direction, or are we still not doing a good job of flattening the curve? Most of the positive numbers today, Garrett, came out of the hospital numbers. I would say the case numbers and the number of deaths were still maybe right in line with that plateau that we've kind of been tracking for a while. Do you agree?
Yes, the case numbers seem to be plateaued, possibly because of this processing ceiling that we seem to be running into. With this 15,000 is pretty much as far as they can go. And so while we have, but what we can say is that the the result, the percent positive of the tests that have been coming in at a little lower than they used to be. They used to be, they could go as far as 34%. Right now we're sort of in this 21 to 24% range. Now the former director of the AZDHS, Will Humble, did put out a sort of a blog post on Twitter saying how one of the concerns he has is that if they're not properly freezing all of these tests, the chances of false negatives, if you will go up as the test degrades. So, and I don't know anything about that. I don't know if tests are being degraded. I just don't know. But that's something that someone who used to run the AZDHS department did say could be a concern. Yes.
Yeah. So that would mean getting those results is even more urgent. Not only is it urgent to get somebody that information so that they can protect their friends and their family or be released from self-quarantine, and also to make sure that the test itself isn't degraded in any way.
Correct. Yes.
Okay, we're getting some questions about R-naught, as we knew we would. Stephen Daniels is asking, did you already cover the R-naught? No, we did not cover the R-naught for you, Daniel. And it was it at 96 today, 0.96?
It is at 97 today, based on RT.live. So, and today it's because we've sort of gone through the variations of the weekend. It's a little more, I don't want to say trustworthy, but we can at least sort of look at it with a little bit less skepticism, if you will. And you can see there's a lot more green here. We're being joined by other states: Oregon, Washington, Ohio, South Carolina, Delaware, New Hampshire's now in it, Arizona, New Jersey, Connecticut, Maine, South Dakota, and Utah. Here we are sort of in the middle of that RT range, 97, with an estimated, basically a low of, it could be as low as 0.76 and it could be as high as 1.17. So you always have to take those error bars into consideration when you look at this. Super important.
And Garrett, an RT number R-naught is only affected by the case count, so it would not be affected. It doesn't care if you're hospitalized or you recovered at home or you had a slight cough or you did not survive this. All they're looking at is the actual cases.
Yeah, there's a methodology and a formula that goes into calculating the R-naught, but they're most concerned with rate of transmission, with the percent positives of tests coming through and what the case growth is. That's sort of the bigger weights for the R-naught than other things.
Yeah. Cliff is asking us for some real numbers. Cliff, let us know exactly what real number you're looking for, and we can help you dive right into it. We can help you find it. That's what we're doing here is walking people through these numbers so that they can find them each day, teaching them where they are on websites that are representative of Arizona numbers so that everybody on here can make better choices for their friends and family. We're not here to decide what's right for your life. You know your family, you know your family's health. We're just here to help you find the numbers so that you can make the best choices for yourself and your family. So many people on here are up against decision time. A lot of people are hearing from their school district, their kids' school district, that they have to have an answer on school by Friday. So this is weighing heavy on a lot of people's hearts right now in what they're going to do. So we're happy to answer any of those questions for you and show you where you can find the numbers so you can make the best choice if you're up at that deadline on Friday, or even if you're in one of the school districts that have already made the decision. For my kids, luckily the decision the school district made was the exact same we had made for our family. So we already knew what we were going to do. The school made them the exact same choice. And then, so regardless of what the governor says at this point, we're already settled. We're not waiting for Wednesday, but I know so many people are waiting for the governor to speak on either Wednesday or Thursday. So I know when we're 2 weeks out from the start date of school, you're feeling so unsettled. So we're hoping that you can get some answers really soon. I know a lot of people wanted those answers last week, and Garrett, we had already done our conversation here, sent it out to the governor, and he did his stuff. And then early on in the news conference, he's saying, that's not going to come today. I'm going to tell you what it is next week. And everybody's like, oh no, we have to wait another week. Okay. Leo's asking a really important question. What are their survival rates compared to 2 months ago? Leo, this is a really important question, because when this whole thing started and we were looking, we didn't have as many cases here, and we were looking around the world and watching the numbers. And then we were watching it show in the US, and we were watching the numbers, and we were watching the numbers in New York. We were seeing the death rates at 7%. And as we got better at all things, we got to know the virus better. We got to know how to treat it better. We got to know how to protect ourselves better from this, what was working, what wasn't. I mean, we've been in this. I keep saying, Garrett, that I started talking about this on television on January 17th, and it is past July 17th. It is July 21st already. So for months and months, we've been going over this. So it was at 7%. The rate around the world right now, Leo, is 4.1%. So 4.1% do not survive this around the planet. In the US, we've managed to pull that number a little lower to 3.7%. And here in Arizona, we're right at about 2% at this point. So one of the important factors to remember in all of this, though, Leo, is that death lags. So we won't know the true numbers because we've just had this spike in tests, a spike in cases, then a spike in hospitalization, and then you see those peak numbers. So while I tell you what our percent is right now at 2%, be careful with that, because what we're seeing around the world is 4%, and what we're seeing across the US is 3.7%. Garrett, is there anything else you would add to that?
Yeah, I would add that a lot of back in 2 months ago, especially in some of the other places in the country, one of the biggest places hit were long-term care facilities, and that's where we saw much higher rates of death and in the older populations. But because we sort of got hit with this later than some of the other states, our long-term care facilities have done a better job of locking things down. People have died, unfortunately, at long-term care facilities, but we have done a better job. And right now, the rate of deaths at long-term care facilities in Maricopa County, which is the only county we know of that tracks this and gives it publicly, is going down.
Yeah, it's incredible news to be able to protect our vulnerable population like that. Thank goodness, because I know I've personally had a big number of friends lose parents and people who were in long-term care facilities on the East Coast. So I know that this affects Arizonans as well. Candace is asking about this hospitalization chart shows 61% unreported cases. Is this chart showing the incorrect data? Do you know which chart she might be?
Yes, I do, and I've got it shared, and I'll sort of explain what's going on here. So, and this is something that people do have questions about, and I hear it all the time, and that's totally fine. It makes perfect sense. So, what you're looking at here, and in fact, in all of these are all powered by one essentially massive data set in which all of these cases, whether hospitalized or not, all have to be put into the same data set to then be fed to this dashboard. So what you're looking at with this 64% not hospitalized, the vast majority of these are simply cases that aren't going to require hospitalization. And as you can see, there's nothing on here in this dashboard that says hospitalization not required. An epidemiologist is not going to put something like that because you don't know if hospitalization is not going to be required. So you just have to sort of leave those in a bin where they haven't been hospitalized. So, it is a combination of both cases that will not have to be hospitalized as well as hospitalizations that haven't been reported yet. As you can see, we have a pretty steep downward climb here. I haven't calculated the lag for the hospitalization curve yet, but it's likely higher than 13 days. It takes a long time for them to get this curve right. It's very, like I said, it's very meticulous. They want to make sure they get it right. So, we have to look at this and not expect we're going to get data now on this. It's going to take them a while to get through this curve. But realistically, that 97 or whatever it is, 94,000, this is not, most of those, the vast majority of those will not require hospitalization.
Yeah. Let's see. Colleen writes, living alone and isolated in long-term care facility is not a life. Colleen, we absolutely agree. That's why so many places have worked so hard to keep that connection going, to have pen pals set up, to have iPads set up so that everybody can FaceTime, to teach our vulnerable population how to use those devices so that they're able to communicate with friends and family. They've done, they've devoted so much time and effort to make sure that we keep this group connected. And honestly, living through a pandemic, period, is not a life. This has not been fun for anybody. So everybody's just trying to get through it as best we can and try to support each other through this. Obviously, mental health has been a big issue through all of this. Pandemics are not fun. This is not not great for anybody. But I think people are really doing the best they can in all of this. All right, we've already been here chatting away for 40 minutes. Garrett, any final things that you want to get to? And if anybody has any last minute questions to get in, let me help you find this information. Let Garrett help you understand some of these charts so that when you look it up each morning, you can find this information for yourself. That's worth mentioning as well, Garrett. This info on the Arizona Department of Health site usually comes out. They've staggered it now. When Garrett and I started doing this, it would come out at 9 in the morning, and all eyes were on Arizona when our situation started to get a little dicey, a little out of control. And then everybody jumped on this website, and then they got smart enough to kind of stagger release some of the info so it wasn't overloaded by everybody across the country when we really felt here in Arizona we should have this info first. So now that it's released at different times, you can check it at about 8 to 9 in the morning, and you'll get
yeah, it's usually between 8 and 8:30.
Yeah. Or check
I will go over the just go over the modeling really quick. This is using the MIT model, the covidprojections.com. Just to sort of show where everyone is. This one also has an R0 estimate. It is at 0.94 in this calculation. And then here we go down to, so this calculation right now, and this is done with machine learning, and what it's saying is that we are, at least as far as our current infection and total infection, we are on the downslide. But as far as the upper range, it's saying, well, we think you're on the downslide, but as far as an estimate is concerned, you could still be at the peak. So, you know, that's sort of, I know it's sort of crazy to hear that, but that's why they have these error bars. And then just so everyone knows, this is the total infected estimate. It believes that 1 million Arizonans have been infected by this virus since the beginning. So with a range of about 1.6 million to 600,000.
So if we have, you said 1 million people will be infected or
no,
are
have been infected. Yes.
So if we have 7 million people, just over 7 million people here in Arizona, that's a pretty incredible number.
Yeah, it's yeah, absolutely.
Wow. Allie is asking about where you can watch this. Is this on TV or just on Facebook? Allie, thank you for the question. This little thing Garrett and I've been doing here for about a month or so has been so popular, and we appreciate you wanting to know this information and sharing your time here with us every day. So we are happy to report this is also now on your favorite streaming devices. So usually we're just here on Facebook, but in the evenings, I believe around 7 o'clock, you can watch it on your favorite streaming devices on Roku and on let's see, help me out with some of the other
Fire TV.
Fire TV, Apple, all of those. Whatever your favorite streaming device is, that's where you'll find it. So thank you to all of you on here who have felt that this information is of value. Like I always say, we are not here to make decisions for your life. We're here to help you find this info. Carrie Redding, thanks for doing this. I watch every day. Carrie, thank you so much. And what cute little dogs there in the picture. How fun. When are you taking them for a walk in this heat? My gosh, I feel like you got to get out there at crack of dawn or late at night, or let them run around in the sprinklers. They are so cute. Okay. Oh, Dorothy's saying she's watching on YouTube right now. Thank you, Dorothy. We appreciate that. So another place you can watch, and Dorothy Jones is so often on here. So thank you. Vicky writes, please keep reporting on Facebook. We have no plans to abandon this at any point. So we just want to, keep everybody up to date on this. So Vicky, we'll be right here with you. Lou's saying watching from Facebook as well. So thank you to everybody for joining us on here. All right. I think that might wrap it up for the day, Garrett, unless there's any final thoughts. Oh, you know what? I saw a question go by that was asking, what do you think tomorrow's going to look like? Usually Tuesday's a pretty overwhelming day. Sometimes Wednesday is as well. What do you think for tomorrow?
So Tuesday is usually a shock to the system, especially for deaths. But Wednesday we'll usually see a lower death number, and then but we might see a higher case number tomorrow. So just understand that there's a good chance we'll see a higher case number, but we could also see a higher number of tests, which will bring down a percent positive, which is also what we want to. That's also a very important number. So it's right now we're sort of in this mixed bag where every day we're taking these numbers one day at a time, but realistically, you're really not going to know where you are in the curve for another 2 weeks. So we feel like we're on the downswing, and we feel like things are getting better, but we won't really know for at least 2 weeks.
Yeah, I think the most important thing in all of that is stay the course.
Yeah.
Keep wearing a mask, keep staying at home as much as you can, all those things. Patty writes, thanks, guys. You're much appreciated. Thank you, Patty, for saying so. We just, again, want to help people find this info. So that's our dedication right here. Oh, Debbie's asking, Governor Ducey, I think she's asking, where is he? When's he going to show up? We're thinking midweek. So, Debbie, as soon as we hear anything more about specifics, I usually post it on my Facebook page. That's another thing. You can contact me over on Facebook. It's facebook.com News from Katie, and also on Twitter, which is at Katie Rammel. Garrett's on Twitter at Garrett_Archer. I'm seeing a lot more people razz Garrett on there, so that's good. Now, what were you called earlier? The Batman of data, I think earlier. So, yeah. Oh, yeah. Debbie's asking, when is Governor Ducey updating us? As soon as we know, Debbie, we'll let you know. We usually know day of. So it's not like we're going to get a lot of lead time on it, but we assume, since he usually speaks on Wednesday or Thursday, that it'll be then. And it's usually about 3 p.m. It's usually about midday after we meet you right here. So thanks for taking time with us today. We appreciate all of you for spending a little part of your day with us. We hope you gain better understanding of the Arizona numbers as they pertain to coronavirus. We'll have even more info for you on those shorter testing lines and all the news of the day on ABC 15 News at 4, 5, 6, and 10. And as always, the latest info at the web address on the bottom of your screen, abc15.com/coronavirus.